Hi, my name is Eilín Ní Mhurchú, and I'm the liaison nurse for the Jack and Jill Foundation covering the area of Cork. Thank you for being invited to speak here about the collaborative work that's being done in children's palliative care in Ireland currently. I suppose, what do we mean by collaborative working in nursing? And I suppose, you know, the child and family are always at the centre of everything, and that's what we're always trying to keep. And I suppose for us, it's how to best support that family and share the knowledge and experience of all the professionals involved. And for that to happen, I suppose it's all about having excellent communication. So we endeavour to try that all the time and every day. So the aim of this presentation is to inform and demonstrate the collaborative services available to families and children with palliative care needs in Ireland. And what we have done is we have each speaker will describe the service that they provide and demonstrate the approach of collaborative working through the use of a case study. I suppose we're very grateful to the families for giving us permission to use their story and photographs of their children. So I will speak about the Jack and Jill Foundation, and then Siobhan will speak about the home care team and their input into palliative care. And then we will have Terry from Laura Lynn, who's speaking about the Laura Lynn at home service, and then we will finish with Gail, who will give us an outline of the role of the clinical nurse coordinator for children with life-limiting conditions. So, for Jack and Jill, we're a small charity that is celebrating 20 years in operation this year. And I suppose it was founded by Jonathan Irwin and his wife Marianne through a personal experience with their little boy, and they decided to put the blueprint for that service in a more formal way, and they set up the Jack and Jill Foundation in 1997. So we consist of 12 liaison nurses who are geographically located around the country, and I'm down there in Cork. And currently these are the families, or just an outline of the families that we are supporting. So at any one time it would be around 330 families. So I suppose you can see even from the map how challenging this can be sometimes geographically. And you can see, as I always say, Cork is the biggest county in Ireland, so sometimes it's a long old drive down to the Beara Peninsula from Cork City, where I live. And we laugh in the office when the girls say that their families are off the M50, and I'm thinking, you have no idea, lads, of the mountains. So I suppose in the last 20 years we have supported over 2,200 children. But really, over the last number of years, we would have around 300 families at any one time. So what we do is we have the child and family there in the centre of everything, and we provide a service, an in-home respite service to children with significant neurological conditions. And as in from last week, we are now supporting families of children up to the age of 5 years. And we also provide end-of-life care to children up to the age of 5, irregardless of their diagnosis. So in doing that, we try, most of our work as a liaison nurse is around supporting the family and advocating for them. And I suppose listening, and that's such a huge thing, listening to what they feel would help them in supporting their child at home, or even through the services into the acute services, out of the acute services, and just see what would help with them. So in doing that, of course, we link with all the other services, the acute services, the voluntary services, the disability services, the home care teams at times. And I suppose with all of that, you're always trying to be an emotional support for that family, and I suppose a sounding board for them. And another thing that we do then as an organisation is we offer direct funding to families to buy in care. So we would provide nursing or care or respite hours in the home. And for any of the 12 nurses working in Jack and Jill, we would provide hands-on care when and if needed. I suppose we don't have a great job description. It's kind of whatever you meet on the day when you go into anybody's front door, you just don't know what you're going to come across. So we try and be, we provide a very flexible, I suppose, service. So I suppose to demonstrate that service, we decided that we would do a case presentation really to try and show how we work collaboratively and what is involved in trying to support these families with children with life-limiting conditions in the community. So this is a little boy, Dara, that I met when he was a couple of weeks old, and I supported them along with many, many other people, and trying to think how would I compact his life, his very full life, into a couple of minutes. So I did this timeline. So you'll have to bear with me now while I try and run through it. So this is Dara, and he was born in January 2013, and he was admitted to the neonatal unit in Cork at the time with feeding difficulties, and he was a little irritable little boy. And he was eventually diagnosed with hypoxic ischemic encephalopathy of unknown origin, and they never ever, to this day, found the reason for it. So he was discharged home after a couple of weeks into the care of the public health nurse and the GP, which is the norm here in Ireland, and he was referred to us at that time as well. And I met that family in their home, and Dara was a difficult little feeder, and he was a cross little fella, but they were managing, and he had an appointment shortly after that with the neurologist in Cork, who went on to become his primary consultant for the next 3 years. So while the family were doing okay and managing him, the mum decided that she would take a few nursing hours. And as you will see from the timeline as we go on, each green flag identifies the increase in nursing support in the home. And all the yellow flags are the professionals or all the collaborative people who are involved in the care. So anyway, going on from there, they took some nursing hours, and then unfortunately in March or April of that first year of his life, he developed seizures. And as you can see, they took additional hours at that time because they were quite stressed around it all. And at that time as well, he linked in with the disability services who provided speech and language and physio and OT for them. And because of the seizures and because he had a lot of feeding issues, and the family were finding it quite stressful, and they had 2 other little boys, so they were trying to function as a family as well. So we applied to the HSE for a home care package for some nursing support hours, which we got funding for at the time, and that actually was facilitated through the Jack and Jill Foundation, and the nurses that I had already identified provided that additional support in the house. So from then he, as you can see, his feeding, he ended up being NG fed, and then ultimately went on to have a peg inserted, and his seizures were always an issue and were difficult to manage. And you can see that he had increased nursing support yet again there in February of 14 when he was about 13 months old. And they tipped along, all the time in between, but he was then admitted in September to November of 14. He became quite unwell and had multiple admissions to the hospital with seizures mainly, and ended up having an ICU admission, which was very, very traumatic for the parents. And I suppose at that time it really resonated with them how fragile his life was, and I suppose it kind of made them think really about his quality of life at the time. But he managed, and he went back home. But following that admission, he had several other small short-term admissions, and he was referred on to the children's nurse coordinator at that stage for additional support for the family. And as you can see as well, his nursing support in the home increased yet again after those admissions. And then in March of 15, he had a life-threatening admission to CUH, where really his prognosis was very guarded, and there were very serious conversations around his quality of life, and his survival from that admission really. But lo and behold, anyway, he rallied around, even though maybe at a lower level of wellness. And even during that admission, he was referred to the palliative home care team, he went home. He wasn't the best, but I suppose the family really put a lot of thought into it at the time, and the mum made out a bucket list, a very long bucket list, and she was a very proactive mother and did all the things on the bucket list, let me tell you. And but following that discharge, we had a multidisciplinary team meeting, which was vital at that stage because there had been a lot of decisions made. And I suppose, as I was saying, when there are so many agencies involved, and collaborative working is so important, and communication is the key around this. So I suppose at that stage, there had been a lot of conversations, and I suppose it was really important that everybody was on the same page, that everybody knew from a medical point of view what the family understood and what options were there or weren't there for them at that stage. And also where the parents were and where the family were in their understanding of Dara's life and how fragile it was. So that happened, and that was very beneficial, especially because the GP and the public health nurse and the home care team all attended. And I suppose it was very informative, and people really did value it. And I suppose sometimes, you speak to these people on the phone and you never actually see them, so it was really good to put a face to names and to have that discussion. So following that, Dara was at home, and he had a lot of nursing hours in the house at that stage. And then the mum self-referred to the Laura Lynn service because she really, really wanted to have some family respite. And they did avail of that service, and they so benefited from it because she was so... It wasn't really for her, it wasn't about Dara and his care because she felt that was managed locally, but she really wanted that extended support for their family and for her 2 other little boys, and they really valued it. And they did such great memory making as a family in Laura Lynn, and they just really... And they have all the things still hanging up in the house, and she really values those. So I suppose during that time, as you can see, he was discharged from the home care team, even though, he was very unwell, but for Dara, he was well. So it's all, I suppose, relative, how he was doing okay from their point of view, but he was so sick. So from there, then they went on holidays, and, but his feeding all the time was becoming more and more of an issue. And I suppose he then went, in that summer, I suppose, he had a lot of pain. There was a lot of issues around his feeding, and fortunately or whatever, or unfortunately you can say, he had an issue with his Mickey button, and he was transferred to Crumlin, and which was fortunate in the end because he got to meet the specialist palliative care team, and they had such a great valuable input around his pain and symptom management, which really benefited. And they met Dara. He had never been there before, so they met him and they could put a face to the child and the family, so they were able. And then I suppose that was a link that we could really value later on in his life. So he came home again from there, and that summer then his feeding was a big issue, and he became very unwell. And in May of that year, I suppose he had a lot of pain. He wasn't tolerating his feed, and the mum, we kind of talked a lot about it, and it was decided she wanted him to go into CUH for a review with his primary consultant, which they did. And he went into CUH for about 2 days, and really he was transitioning into end of life at that stage. And he went home, and he was re-referred to the palliative home care team who came to the house, and he went home, and he transitioned into end of life quite quickly and died at home on a Sunday afternoon in his bedroom with all his family. And, it was, I suppose, as good as it could be. But while all of that was going on, I suppose, Dara had a very full life, and he did all of these things in his life. And when you look at it, I'm thinking I still have to do some of those. But he did them all. He was abroad many times. He was ice skating the day he was discharged from CUH, if only they knew. But that was a really important thing for his mother. And he was on the Late Late Toy Show, with Carmel kindly sorted out for him at that time. He used to go horse riding. He made his confirmation and his communion after that, I suppose, very eventful admission to CUH, and the mum really wanted that, and his brothers weren't a bit pleased because some of them hadn't made their communion yet, and Dara was jumping the gun and had a massive seizure in front of the priest the same day. But anyway, and he went to the Jack and Jill. He had a family in Barrettstown. He was there, and he was in Disneyland Paris, and he had a great time, and he even went to Portugal in May, 4 weeks before he died. I mean, I wouldn't do it, but his mother really, really wanted to do it. And I have to say, that family, I still visit them, and she was so excited that he was being presented here today, and she was so honoured, that it would be honouring Dara. And she was saying, "You send it on to me now, and she kept on, she still sent me other photographs last week to add, but I have to say they would really genuinely say that they haven't any regrets, that they packed so much into his life, and so they don't have regrets around that, and they had a lot of support, and only for the support they wouldn't have been able to do it. But in all of that, I suppose, when you think of it, and all the services at any one time, there were 9 services involved in his care. There were 25 to 30 healthcare professionals at any one time. That's not including the once-off consultations that they may have had over the years. And the in-home nursing support, which were the green flags on the timeline, there were 12 nurses involved in the 3.5 years of his life. But and some of those, there were 2 of those nurses there from the age of 6 weeks. So I suppose for that family, that continuity for them, and I'll tell you, there was no problem looking for nurses to mind him in the last couple of weeks of his life. Everybody, they were fighting to mind and support that family. They had such a good relationship with them. So I suppose in all of that, the most important thing is around that collaborative working and about communication, and trying to support them, and every professional in that list were needed, and their input was very valued and wanted. So I suppose even if you may not be the lead or one of the key people in there, everybody had something to bring to them. They all had a reason to be involved with them, and that was all very valued by that family. So I suppose, what did it mean to them? So for what his brother said was, Dara did lots of things in his life, that they're still waiting to do some of them. And what his mum said is, we couldn't have done it without the help and support. We would have spent our time in hospital. I really believe that Dara wouldn't have lived as long. We needed all the help, but Eilín, you were our sounding board. And I suppose for that family, I was their sounding board. I was, their key worker, or whatever you want to call it. That was something that evolved naturally. I suppose I did have that. I was privileged to have that therapeutic relationship with that family. But yet all the other professionals involved were each as valued and needed. And I suppose that was a parental choice, I suppose, really. And I suppose that family, I still link up with them, and they're going to go to Barrettstown to the bereavement, or they have attended it twice. And they still have very, I suppose, positive things to say about all the care and support and the agencies involved. I'll hand you over now to Siobhan. Thank you.